Thank you very much for inviting me to have a talk on the clinical applications of honey and its scope as an possible antibacterial therapy in cases of multi-resistant ocular bacterial infections where we can have the MRSA involvement. So I have plenty of slides, so I will be going very quickly. I'm the last presenter. I have been working at the Institute of Ophthalmology for the last 31 years, and I'm basically ocular microbiologist. This is my institute. Actually, if you see the holy books, in holy books of Muslims, Quran, this has been revealed that this has got a curative property. In other books also, similarly, you will find in the history that including Veda, Bible, and other books, you will find. This is the script from holy book, and you can see that there is a healing property in honey. So this is the basic thing we have been thinking, that this possesses the healing property. Therefore, all over the world, the people are thinking about its possible role as a possible antibacterial agent. Similarly, you will find that this is said to be a prophetic medicine. Before 1,400 years, they were using honey as a curative agent. Now, there are many properties which can lead to the anti-inflammatory and antibacterial activity. I am not going to discuss all this here, but we can say that there are many clinical applications and scopes in traditional medicine. Thousand years, the people have been using honey in medicine. For example, it has been very popular in folk medicine. With the help of these pictures, I will be trying to show you that this has been used as a traditional medicine in many countries around the world. You can see these pictures, and you will find that, for example, in Russia, they use it in the World War I, and it was able to prevent the wound infection. Therefore, this is accelerating the wound healing. Our purpose is that how can we use it in ophthalmology, particularly for the infections involving multi-resistant organisms. Now, Manuka honey from New Zealand is very famous all over the world as a medicine. They have been using for as an anti-inflammatory agent and for the other purposes also. And I will be showing you many of the products of honey. For example, here in the history you will find these pictures that it has been used as a very good dressing agent. Nowadays in Canada, they are using it as a gauze in cases of burn and wounds. See these sterile gauze, and they are using the honey. Again, this is the treatment. Again, you will find a number of infections, wounds, burns, and ulcers being treated by honey. The ulcers have been reported to be including the foot ulcers in case of lepers. Mycobacterium leprae infection, you will find they have reported that there was some progress in the healing of the ulcers. You would be surprised to see that 6000 BC and before 8000 years, there is a history that the uses of honey in medicine have been mentioned. If you see the words Honey, you can speculate this possesses the healing property. This can reduce the edema. This is highly antiseptic and antibacterial. This possesses the curative agent, and this is useful in many of the many of the fields, including dentistry. For example, in Indian system of Ayurvedic medicine, this is very popular. With this picture, we have another Unani medicine. In India particularly, we have many Unani medicine colleges in India, and they are using honey in many of their drugs or medicines. If you see the clinical applications, there are reports. I'm not going to discuss with references all this, but this is fact that these are the infections. You can see here a number of infections. This has been reported to be having a very good effect. And this slide shows you the many, with the help of many publications, this will be useful for many infections, including the wound infections, burns, eczema, sore throat, dental caries, stomach aches, and other infections. Similarly, many of the bacterial species have been reported to be susceptible to this miracle drug. Now, on the basis of this, we can conclude that we are particularly concerned here in ophthalmology, that we can think about its use in ophthalmology, in dentistry, surgery, plastic surgery, pediatrics, gynecology, dermatology, and gastroenterology, etc. And I try to show you some of the pictures. But now our concern is with the involvement, with the emergence of antibiotic resistance all over the world, particularly in India, where we don't have a particular policy of antibiotic usage. Now, recently we have been, actually I have been working for the last about 26 years on antibiotic resistance. Now I am working on the antibiotic resistance prevalent among the ocular infectants, particularly the Staph aureus and Methicillin Resistant Staphylococcus aureus strains, which is actually said to be a superbug, and this is resistant to many of the antibiotics. Now, this is the problem all over the world, MRSA emergence. Similarly, you know that a number of infections in the eye are there, and in many of the eye infections, the involvement of MRSA, which is resistant and very difficult to treat, is there due to the emergence of antibiotic resistance. We have also isolated many of the MRSA from the cases of keratitis and other infections. So there are many possible eye infections. For example, here you will find that they have reported in conjunctivitis, corneal ulcers, and other infections, many of the MRSA infections. You can find its involvement in conjunctivitis, keratitis, orbital abscess, and the most devastating infection, the endophthalmitis, and other infections, cellulitis, and this is community associated MRSA involvement in the eye. You see, this is devastating the globe. Now, this is actually an established fact now at the present moment that medical honeys are effective even on antibiotic resistant organisms, including MRSA and other infections like Pseudomonas aeruginosa and other infectants. With the help of these products, you will be able to see its use, which will prove that this is highly antibacterial and even can kill the MRSA. So these are the products. Now, on the basis of this, now as we have been isolating and there have been reports. So what will happen if the infectants in the eye are resistant to most of the antibiotics? So beforehand, we have to have some alternate therapy, and we have been thinking due to its role as antibacterial agent, whether we can possibly think this as an alternate antibiotic therapy, because honey is said to be the nature's or Almighty God's splendid gift to the mankind. Now, these are some of the publications on MRSA from our laboratories. You can see these. On the basis of this, that we have proved that there are MRSA involvement even in the eye. So we have to think about the alternate possible therapy. In India, you will find even this, they have developed this eye drops, which might be somehow effective. And there is a good news that recently in Slovak Academy of Sciences, they have reported honey prophylaxis even can reduce the risk of endophthalmitis during pre-operative period of eye surgeries. In this journal, they have recently reported this thing. Now, I will be showing you some of the slides where you will find that many of the products having honey are very popular all over the world. I have been working in many of the European countries, and Japan and Saudi Arabia and England, and I have seen that many of the products are available. In Turkey also, I have worked at the University School of Medicine in Ankara. This is the picture from Venice. The whole European markets are flooded. This at least I have seen. I have not seen in America, though I came here in 2010, but I could not find many of the products, or I could not say. This is the picture from the Turkey. See the products having honey. This is a lot of honey you will find in European market are flooded with the products. You can see in Czech Republic, and this is in Vienna. You can see in many of the countries. This is very popular. This Manuka honey in New Zealand. This is supposed to be the medicinal honey, and they are. This is available online also for many of the diseases, they claim. Now, these are another products. You can see acne cream, strepsils even, and you might have taken here in the breakfast also some of the products for the pediatric products, other products as antibacterial agent, in the oral for the teeth, antiseptic solution, anti-wrinkle lotions, skin lotions, skin creams, wound healing creams, of course, in dermatology and eczemas, and as antiseptic spray, of course, and many of the products in shampoo and other products, including soap. These are available. And the wound dressings with the Medi honey, this is another product. Gauze are available nowadays for the beauticians. They are using, of course, and as antiseptic spray, of course. This is in the Middle East. These products are very popular. Marhaba honey, Manuka honey, of course, and in the other products, Medi honey, also antibacterial wound gel is there. And so, as I told you that I have worked in the laboratories in Japan, Germany, UK, Slovak, Turkey, Libya, Kingdom of Saudi Arabia, and I have worked in UK at the University of Ulster, and I was surprised to see its antibacterial property at this university, which I obtained actually from the ocular infections from the hospital. And now these are some of the work from our laboratory. Recently we have finished this work on the uses of topical application of branded Manuka Honey drops on 100 subjects, and we could find that this was effective in the dry eye cases. At least this was reducing the bacterial population. This is the work in Slovakian laboratory. And as I told you, that antibacterial efficacy of topical honey in dry eye patients as a clinical microbiological study we have finished, and this Manuka honey was used, and you can see that this line diagram shows that there was a reduction in the bacterial load after use of topical honey at various period of time or interval. Similarly, here you can find a sharp decrease. These are some of the MS thesis for MS ophthalmology students and other students we have finished at our laboratory. Now, I presented a paper in 1992 and in Indian Express, in our Indian newspaper, this was highlighted. This is the summary of. Now, on the basis of all this work, we can conclude that we can have a potential prospects and scope of honey as an alternate antibacterial option in future, particularly for the treatment of at least non-responding life-threatening multi-resistant pathogens, especially the superbugs, Methicillin Resistant MRSA, when they are not treated and we are not successful to treat such infections, including many eye infections in the eye. So this is for the ophthalmologists and other researchers to think its use in ophthalmology. Thank you very much.
Any questions? Yes.
How to use honey in the eye?
This has been very popular. In the history, you will find that when antibiotics were not available, the people in the villages, particularly in India, they say if you don't find any antibiotic drop, you just put the honey in the lower conjunctiva, and the infections are usually controlled because of its anti-inflammatory and antibacterial activity.
But in mouth, for dentistry, how you will use? What are the ways you can put? How to deliver?
How to?
Deliver this drug, honey, in the mouth like dental.
No, they are using it in the paste even.
Paste?
Yes. I have shown you the products.
Actually, Dr. Shamim, there was also a concept that honey, because it's very, it's a high pH, acidic, and it is very high.
No,
absorbs
low pH.
Sorry, it's acidic. It's
Yes,
acidic,
yes.
and it absorbs all the waters. It doesn't allow the
Yes.
bacteria to grow. On the other hand, if used in the ocular preparation, as an ophthalmologist, I am concerned. A lot of my patients too put honey and come, and we are right now not pro it, although all the market is flooded, because whenever you put any other antibiotic solution along with the honey, it doesn't allow the penetration of any other drug or any other fluid. It causes too much of, it absorbs all the water. If you have read this thing, that there's the oldest viable edible thing surviving is honey found in the Egyptian tombs, because it doesn't allow anything else to grow. So if we use it as an ocular antibiotic, in which for MRSA or any other organism, it will not allow any other antibiotic to be effective, because it will not allow the penetration.
No, it will allow. I don't think there will be any problem. But we actually have to standardize this. A lot of work has to be done.
So have you made some drops with this formulation?
We have not developed, But I have shown you in our country they have developed this drishti. I found this. We have to develop this, and moreover we can see the synergistic action and its possible use, so that there cannot be any other side effects, particularly in the honey. We have to do a lot of experiments. This, as far as our work is concerned, we have been using it in vitro studies. So we are speculating that how can we make use, particularly as on the resistant population, even in the eye. But this is possible.
Mechanistically speaking, I mean, what is the mechanism that the honey works? I know that when honey absorbs water and gets diluted,
yes,
you have generation of hydrogen peroxide.
Yes, due to the presence of glucose oxidase, it will generate the hydrogen peroxide,
Yeah.
which is of
So
course
this is
antibacterial,
the
as you
this
know.
is
This is one of the
indirect-
mechanism,
Okay.
and many of the people, they have carried out other studies also. They say that there is inhibin. There are actually many of the unknown compounds present, which have to be explored.
There are so many types of honey. So
Either compositions are different or there is processing is different.
No, this is different always.
All are different.
Yes.
Process-
Therefore, they have developed this Manuka honey
Uh-huh.
in New Zealand, and
Okay.
they are reporting it to be a medicinal honey. And they have shown a lot of papers you will find in literature, on internet. You can find the uses of clinical medicine, this Manuka honey.
So we are a little bit late. Thank you very much for the presentation, and thank you for coming to the session.
Thank you very much.